Es en español, una pregunta en español.
Gracias por la oportunidad, NHCOA, y a los panelistas que se toman su tiempo de venir acá a atendernos nosotros. Nosotros tenemos la preocupación. Yo soy de la generación de los baby boomers, que habemos muchos aquí y a través de todo el país, y necesitamos que nos refuercen ustedes y nos ayuden en la toma de decisiones en las personas que hemos trabajado toda la vida y a la hora del ocaso tenemos menos beneficios que los que no han trabajado. Yo vengo aquí a alzar mi voz, les dejo esta preocupación a ustedes y quisiera que me dijeran qué se está haciendo sobre eso.
A ver, me permite la traducción. First of all, I want to say thank you to NHCOA for allowing me the opportunity to direct myself to you. I want to say to all of you that I am a baby boomer and that I've been involved in this for quite some time, but my main issue is the following. Otra vez, ¿qué es lo que dice su mensaje en español? Díganlo a mí.
¿Qué se está haciendo por
What
las
are you doing
personas
for those
que han trabajado toda
who
la
have
vida
worked their entire lives
y tienen menos beneficios
and
que
they
los
have
que no han trabajado?
less benefits than those who haven't even worked at all?
A little spice.
Armando, si me permites.
Please do.
Bueno, muchísimas gracias y déjeme decirle que yo soy del último año de Baby Boomers, entonces estoy con usted en eso. I just said that, wanted to let her know that I'm the last year of Baby Boomers, so I hear her loud and clear. Pero una de las cosas que estamos haciendo es aumentando el número de beneficios que tenemos bajo el programa de Medicare, específicamente para los beneficios preventivos, más exámenes completamente gratuitos. También estamos descontando el costo de los medicamentos recetados. Estamos teniendo más programas que pueden beneficiar a las personas que, como usted, han trabajado toda su vida y merecen estos beneficios ahora, y también para los que van a llegar en el sistema muy pronto, o bueno, algún tiempo. What I mentioned was that under the Medicare program and the Affordable Care Act, we are adding more preventive services, a lot more benefits. We have a lot of new benefits that you can now take exams that are completely free, and also adding more services for beneficiaries, for those people that have worked all their lives, or those people like me who will be there before you know it.
Thank you very much. Anybody else in the panel? We have another question. We have one here. I'm going in order. We have another question here.
Buenos días. Soy la doctora Fierro y vengo de Baltimore, Maryland. My concern is very important in regards to health. I am a physician, and my question is, who in the panel or who can tell me if there is a plan with all the cultural competency that is necessary, because our promotoras are doing a good work trying to invite the people to access services for health. But when they go, including the parents and the grandparents, they go to people that they do not understand them, not just in the language, but in the way to express the problems that they have in health. If there is not a plan that really wants to address this issue in health, don't tell me anything that they are doing in regards to promotion and papers and everything that has been proved that does not reach our communities. Many of our people don't read English, some others, they don't read Spanish, and we are really doing a bad influence with the translations. That is imposing something that is against the good practice of medicine. There is a very important rule between the confidence between the physician and the patient, and it is broken completely. I agree, it's better than nothing, but it is not fair. And really, we are late in comparison to other countries in providing a right access to health and the right services for health. I would like that any one of you answer me if there is a plan that can comprehend these points. Thank you.
And if there isn't, what could we do? Please, Dr. James.
I'll start. I don't think that we have anything that comprehensive that you're mentioning. I think there's some potential within the medical home model that's a way in which we can get not just it gets all providers from that care perspective of dietitians, nurses, doctors, and all of that. but also within the area health education centers, that's a way in which we can train people. They're located in those communities with the greatest need, and that they train people from those communities to provide those services in more than just with the promotora model. And that there are potential with these two, I think, mechanisms that you can have a more coordinated and holistic approach to care. I think we see there some tiny models in sort of like Little Havana and Miami, where there have been very culturally competent community health centers and health plans that do things that try to address a lot of these issues, but we don't have a national model that I am aware of. But I think that there's some potential with the medical home.
Ms. Niño?
And that's true. We don't have a national model, but one of the things that we are trying out right now are these things called accountable care organizations, or ACOs. And what that is, they're somewhat like demonstration projects. If you have a certain number of Medicare beneficiaries, I believe it's more than 500 Medicare beneficiaries in your clinic, then you can apply for this. And the way that it addresses health is, instead of looking at it as a treatment model, they look at it as a patient model. So they provide incentives and bonuses on the improvement of the patient. And this is more of an individual basis. And what that means is that that clinic or medical center or hospital, whoever it is that applies for this, is going to work with that patient. And that's going to mean it's going to work with them with their doctor, with a promotora that's going to work with them, or with a home health worker that's going to follow them, so that after they leave the clinic, they still know what the procedures need to be done, the follow through, if you will, interpretive services, or whatever the case may be. That's accountable care organizations, if you'd like to look into that.
Armando, can I just please respond to your second part of the question as to what can we do if it doesn't exist?
Yes.
And I think, as with everything that we're embarking on, is advocacy. Is really being able to go to those organizations at all levels, at the local level, and mobilize. As Senator was saying, we have the power. All of us have the power, really, to make that difference. And to insist and say, no, it's not enough, really, again, to have a pamphlet. It's not enough to have as the doctora was referring to, individuals that may be bilingual, right? Or they may find translation services, but they really don't respond to those cultural nuances that make the difference in terms of the quality of care, of adherence to care, of the family, of all of these factors that are important. So in just one word, it's easier said than done, but it is important, is advocacy.
Yeah, I would agree with
Val,
that.
please.
I want to agree with that. You have to say, no, you're not going to cut Medicare. That we work for that. Now when we need it, it needs to be there. Let's fix Medicare and make it better. One of the ways we need to do this is get physician assistants, nurse practitioners who work with you and help, so the patient understands, and they work with you on confidentiality, so they make it possible for you to see more patients and do it well, and they have to be culturally sensitive. So that would be one answer to this, but we must insist that we make Medicare better. And one of the ways that we do that is to pay physicians fairly, because right now what we're paying physicians in Medicare is criminal. I don't know many of my friends who are doctors. They worked all of their lives to be the best thing you could be in society, but they don't want their kids to go into medicine because we've made physicians policemen for the government. We're not busy treating patients. We're busy filling out all the paperwork. Where did the presumption of innocence get changed? So a physician is guilty unless proven innocent. Yeah. So there are some things we got backwards that we need to change in the American healthcare system. But with your help, remember what was said by my friend here on the panel, we have the key in our own pockets. Javier said it, key to whatever jail we make, whatever problem, is in our hands. So we have only to turn it and work together. That's what we need to do.
Unfortunately, the time is really eating us. If we can make the question short and then the answer short, and see if I can get a couple more.
Okay, I just want to make a comment. I'm with the National Consumer Voice for Quality Long-Term Care, formerly the National Citizens Coalition for Nursing Home Reform. We have members in all 50 states, and I just want to stress the importance of advocacy for quality in long-term care. Hispanics are increasingly likely to spend their last days in nursing homes. The research shows that Hispanics are substantially more likely than whites to be in the worst nursing homes. That's nursing homes who are understaffed and who perform the most poorly on inspections. Very important to be aware of this and to advocate for quality and to advocate also for the Hispanic workers in these facilities who are providing care underpaid and extremely overworked.
Yeah. Thank you so very much. Thank you. Question, there is another one right here. Very quickly, so rapidito.
Carmen Miranda Jones from Perfil Latino, South Jersey, representing here. And my interest was in the information you wanted to, you were saying about promotoras. Where do we get the information? Don't they?
You can feel free to email me. Teresa, T-E-R-E-S-A.
I'll hold the microphone for you. There you go.
Dot Niño, N-I-N-O, es que no tienen la ñ, de Niño, at cms.hhs.gov.
One more.
Okay, good morning. Following the lady's question, there's a lot of people that work all their lives and they end up without benefits. And we are going with that line, there's a lot of seniors that they work all their lives and then they found themselves homeless. In order to qualify for a lot of benefits, they have to have an address. So are you all doing anything for those homeless seniors that is increasing because of housing crisis and everything else?
Is there anything that anybody can do? Any agency that you may know? If there isn't,
there's senior housing programs through the Housing and Urban Development Department, but I'm not very familiar with those. But there are some senior housing.
It's an important problem to consider. Okay, quickly.
Thank you, Armando.
Thank you.
My name is Constantina Mizzi, and I'm the CEO from the Latino Alzheimer's and Memory Disorders Alliance, based in Chicago. I will be fast, really, Armando. During the last 2-3 years, we did more than 2,500 memory tests in Spanish completely free to the community in Los Angeles, Chicago, and New York. We're doing our homework, all what you said, everything in Spanish, health promoters, social workers, caregivers. We collaborated with more than 25 hospital clinics and institutions on those 3 principal cities. My question for you is, well, first of all, the data. Hispanics are 16% of the population. Only 3% are represented in all research studies in general. So the question is, what are you doing to support agencies to do more Hispanic elderly population studies? We need to do that. I mean, we won't find the cure for not only for Alzheimer's, but for many other illnesses if we do not have individuals who are Latinos and Hispanic and share studies and do studies. And the agencies, we are doing our homework. This is a cultural issue. We're talking with the community. They are agreed to do this research.
What can we do? What can we do? Sorry, time is eating us. I apologize.
Right. So
Please.
There's a group that's headed up down in Baylor at the Intercultural Cancer Council who's done a lot of work on EDICT, and that's eliminating disparities in clinical trials. And they've put together a backpack of things that can be done to increase the probability of including more Hispanics and people of color in clinical trials. One of the barriers is obviously insurance doesn't often pay for participation in clinical trials. So what can we do to remove some of those barriers? Outreach to providers to make sure that they also recruit more participants who are people of color. In I think it was 93, the NIH had the inclusion of women and minorities in part of their proposal, so that you had to submit a grant that had a proposal that was going to include recruitment for that. But now we're in a situation where many clinical trials aren't actually funded by the NIH, and they're funded by the pharmaceutical companies, so we need to do more to reach around that. So if you're interested, I would look up EDICT, and they have a website in their backpack.
There is an announcement. There's an announcement. Since you have so many questions, we are scheduled to have a coffee break. Our suggestion is, it all depends on what you think. Our suggestion is, we'll go grab the coffee, come back here, and we'll continue our conversation. Whoever wants to stay, stays here, ask the questions. We're going to have our panel working a little extra time, overtime, but I know that they won't mind. And this is such an important conversation that we need to expand a little bit. And so we will do it briefly. If you want to get coffee and come back, please do that orderly so that we don't disturb whoever stays here. And let me just, before you go though, wait. Ladies and gentlemen, wait, because there is an important announcement that we want to make here. Doctora, your name, please.
La doctora Alicia Cuarón de Denver, Colorado. Yesterday, the Assembly of GRES top leaders discussed a couple of issues that I just want to bring up. I want to thank all the panel members and certainly Dr. Cruz for bringing us all together. It is the issue again that Latino seniors are assets and they're also voters. Nosotros sí votamos. As we face economic issues, we must protect our vulnerable seniors, nosotras mismas, from national debt being a burden on our particular shoulders, especially since we in the past ensured the safety and the well-being of this nation. We applaud the president for rejecting to turn Medicaid and Medicare into the voucher system, his refusal to increase eligibility age for Medicare. And we must remember all the time that as Latino seniors, we must ensure that we have the proper health care. Nosotros, como personas de tercera edad, nosotros sí valemos la pena. Nosotros necesitamos la ayuda. Nosotros también hemos trabajado para asegurar el futuro de nuestra nación. Muchísimas gracias.